I'm Moira Lyons and I've been involved in clinical research as a research volunteer for the past 2 years. Clinical research is important to everybody. There can't be many people who haven't benefited from research one way or another, even if it's just taking an antibiotic or having a vaccination. If you have a long-term condition or a life-threatening illness, research can be invaluable. And research is essential because to make progress in any field always means asking questions and being able to test new ideas. It's important that researchers respond to clinical need, the sort of things they might see in their day-to-day work, but it's just as important that they respond to what patients and carers want and what's important to them. It's increasingly being recognised, and particularly within the NHS, that if you include patients, carers and members of the public in healthcare and health research, it improves outcomes for patients. And that's key. Above all, that's why we do it. My involvement experience has been incredibly varied. I've joined a number of different groups. I've been involved in workshops and focus groups, sometimes as a participant, sometimes as a facilitator. I've attended meetings to advise on course content for healthcare students and professionals, given my opinion on research projects at all stages in their development, including looking at funding applications, exploring and monitoring opportunities for patient and public involvement, and advising on plain English summaries and leaflets and questionnaires and other documents for patient and public use. Been a member of a research study steering group and project advisory groups, and as a result been named as a co-author on published academic papers. I've taken part in role-play sessions to give students a more realistic patient experience and sat on interview panels for university students. I first became involved because I felt an increasing need to do something useful, and I continue to be involved because I love what I do. Some people find that the experience they gain is a useful addition to their CV, and some just want the opportunity to find out more about something that interests them. Over the last 2 years, I've met so many really interesting people. I've learnt about things that I didn't even know existed. I've had lots of fun and made some really good friends. And all that whilst having the flexibility to do as much or as little as I want to. And the choice is always mine as to whether I want to give my time or not. At the beginning, it can be quite confusing trying to work out exactly what your role is, but things do get clearer the more you do, and you realise that what's important is frequently not what you know, but what you don't know, and that your opinion is always valid. You may find that you're in a position to ask questions that other people don't like to ask, perhaps because they feel they might be expected to know the answer already, or because it challenges established practice. Either way, your perspective can be invaluable. And never forget that just because you can't see the point of your involvement doesn't mean that there isn't any.